Dr. Emanuel, good to see you. Thanks so much for joining us this morning.
Nice to be here.
So the replacement bill is focusing on returning power to the states to regulate health care. Your thoughts?
Well, first of all, it's very interesting that Senator Collins talked about repair. So she doesn't view this as a complete replacement. And in fact, the bill has 3 provisions. Provision 1 is, if you like the Affordable Care Act, you can keep your exchange, you can keep your Medicaid expansion, you can keep the Affordable Care Act. And so I think many states, especially the big ones like California, New York, are going to do that. Second of all, if you don't like anything, you're Texas, you don't like anything ever, you don't have to do anything. And the third option is, if you're a state, we're going to allow you to auto-enroll people into a health plan and give you $5,000, give the people $5,000 for a health savings account. It looks a little complicated, especially for people who don't have a lot of health literacy. I will note that this is at least the 4th bill by Republicans. They don't seem to be able to coalesce around anything. It's a very different bill than Representative Paul Ryan's bill, very different bill than Representative Price's bill. It is certainly not a block grant Medicaid bill, get rid of the exchanges bill. So exactly where we're going with health care reform from the Republicans is very, very unclear. And I would say that President Trump's executive order, I think, was more, as people put it, signaling, yes, we're going to do something, without a lot of substance. It didn't say what they're going to do, except to say that they're going to respect the law.
Well, it was day 1. I mean, to be fair, it was day 1. I mean, on day 1, he came in. Yeah.
Maria, let me say, he said, you've got to respect the law to give notice and consent for regulatory changes. That is a very important point, because that takes months, if not years, in many cases, to change regulations. In other words, the notion of repeal and replace happening in the first 100 days, not on the agenda.
Right. Well, let me get to Dagan here. Go ahead.
Dr. Emanuel, will Democrats, though, get on board with any idea to
yes.
fix the Affordable Care? Because, again, yesterday, because the Senator Collins and Bill Cassidy plan, it seems pretty reasonable, and Chuck Schumer immediately shot it down and said it was a cop-out.
Well, I do think it doesn't actually solve a lot of problems, but I do think that there's a path forward for a bipartisan repair bill, just as Senator Collins said. I don't think this happens to be the repair bill, but as you know, in the negotiations in Congress, people put out ideas, and then there's a negotiation. I think the real question here is whether they're intent on doing something bipartisan or not. Because if they do something Republican alone, they don't have 60 votes to really fix the system. If they do something bipartisan, there are issues that Democrats can point out with the Affordable Care Act. I would note one of them is we probably do need to strengthen the mandate or go to an auto-enrollment process. I like the fact that Collins and Cassidy have auto-enrollment. I think that could be a bipartisan point of agreement. I think that there are some other things we can do. We all recognize, as again, Collins and Cassidy do, that we need more subsidies for people between about $50,000 and $90,000 to get into the exchanges and buy insurance. So I think there's a number of ways we could repair, and Senator Collins said, the Affordable Care Act. And that's probably where we need to go.
Let me ask you a real-life question, because I had an experience 2 weeks ago. I wanted to get an MRI, and the center that I was directed to did not take the insurance I had. I wanted to pay out of pocket. I actually said I want to pay out of pocket, and I was told that because they said they have multiple centers, they've got contracts with the various carriers, they would not allow me, their contracts did not allow them to have me pay out of pocket to get an MRI. Does that make any sense to you?
No.
So
I mean, that's like going into it's like going into a store and they say, we take Visa, we take MasterCard, but cash, we're not taking your cash.
Well,
just doesn't make any sense.
I just want you to understand, that's what's happening. That's what's happening out in the marketplace.
Sir, look, I agree with you, but let's blame the right thing. That's not the Affordable Care Act. If that's the insurance company, that's got nothing to do with the Affordable Care Act. If insurance companies are creating contracts where they don't allow places to actually take other forms of insurance or cash, That has nothing to do with the Affordable Care Act.
CEO and manager of business after manager come on this program and say the reason that they have to either raise prices or cut jobs is because of the cost of Obamacare, the Affordable
Maria,
Care. Listen to this, Dr. Emanuel. I want to play you these sound bites from recent guests on the program. Listen to this.
We want to make sure that patients have access, affordable access to the medicines that they need, and that they can see doctors when they need to see doctors.
It's very clear the insurance pool that was created is not able to afford the continued coverage of these people, so we have to do something to fix that.
I was CEO at Highmark during the time that we implemented this law. There was a change about every week, if not every day, in the regulation, and that has continued. It's way too complex.
So that was the CEO of Merck, the CEO of Celgene, and the CEO of Highmark, Dr. Emanuel.
Okay, let's talk about the two drug companies, Celgene and Merck. Absolutely, they've been raising prices outrageously, and the Affordable Care Act did not do enough in the case of drug companies to rein in prices. I think everyone agrees to that. And by the way, President Trump has said he wants to regulate drug prices, have Medicare negotiate with drug companies. That is not a very Republican position. It's much more a Democratic position.
Why do you think that the premium is... Okay.
Maria, let me finish.
Go ahead.
Let me finish. Okay, now, the data are the data. During President Bush's term, 8 years in office, health insurance premiums went up 80% for employed people. During President Obama's term, health insurance premiums went up 35%, substantially less. Yes, I agree with you. They still went up. Third, I would say, I agree with the American public. Health care needs to be more affordable. You can't read a paper by Ezekiel Emanuel without me talking about cost control, the absolute importance of cost control. I'm from the left. I'm a Democrat.
All right, so then how
we
come
do need to get health care costs. We
Yeah.
need to get health care costs under control, and we put in a number of issues in the Affordable Care Act. Health care costs have come down. They're not still where they need to be.
They're up 116% this year in Arizona. We know that. They're in the double digits across the country. And we're looking at a 116% increase in Arizona this year. So they haven't come down.
And we're looking at negative increases in
India.
Maria, we're looking at negative increases in Indiana and Massachusetts, and California's at 7%. We do need to get health care costs under control. This is a bipartisan point. And the way to get health care costs under control is to change how we pay doctors and hospitals.
Zeke, it's Robert Wolf. I just wanted to say this was the one I did not have to intervene at all with you on.
Can I say one thing?
You've got 10 seconds.
When the Congressional Budget Office looked at repealing the Affordable Care Act, they said prices would go up 20 to 25%. It is not a formula for bringing health care costs under control, the repeal proposal.